Hi guys, I am Dr. Rajat and a lot of my patients have been asking me, can you get dental implants if your jawbone has begun to resorb? And my answer is yes, you can get dental implants if bone is beginning to soften and melt away. To treat this problem, we'll need to perform a bone graft. Now, what is a bone graft? A bone grafting is often prescribed for periodontal patients who have lost some of the bone because of the periodontal disease. Bone grafting materials are designed to treat the jawbone by strengthening it and by adding volume. Once a bone graft has been performed, the bone will gradually regrow so implants can be placed easily. Now, how bone grafting can help regenerate a bone tissue? We'll have to perform a surgical procedure that replaces the missing bone. Bone grafting involves using a material that is a bone grafting, which not only replaces the deteriorated and the missing bone, it encourages the growth of a healthy bone. The new bone strengthens the jaw by causing a bridge to form it between and the graft material. Over time, the newly developed bone will replace most of the grafting material. Now, besides bone grafting, GBR, that is the guided bone regeneration, is used to regrow the bone as well. Now, in this procedure, we place a membrane over the bone graft site to further encourage the bone growth and prevent the growth and the presence of scar tissue at the grafting site. Both grafting and the GBR make it possible to regenerate the bone lost to periodontal disease, and this missing part of the bone is often called the bony defect. Now, the defect can result from extractions, trauma, tumor or cyst surgery. Keeping in mind that different GBR can be used for this process. For example, some membrane are made with the synthetic polymers. In these cases, the membrane must be removed several weeks or months later during a second procedure. Others, GBR membranes are made up of natural materials and therefore melt away or resorb in the body. Most important point is treating the periodontal disease. Now, if you have a periodontal disease, we will also need to treat the disease by administering the antibiotics and performing the procedures. For example, such as scaling and root planning, that is SRP. If the disease is advanced, we'll need to schedule surgical interventions such as pocket reduction surgery, also known as a gum flap surgery. While scaling and root planning, SRP is less invasive, gum flap surgery is prescribed if SRP procedure cannot be used to treat some deeper gum pockets. The idea of either procedure is to remove the tartar that is causing the infection and to smooth out the roots of the teeth so they do not accumulate plaque as well as calculus. Now, both these procedures are necessary to prevent further bone loss and infections. So, are bone grafts and GBR procedures painful? Not really. When you receive a bone graft or a GBR, it is done under anesthesia. Therefore, the procedure itself is not uncomfortable or painful. We normally prescribe an antibiotic and pain medicine after the procedure. And the use of these therapies allows the jaw to become stronger over time. So, implants can be placed or periodontal disease can be treated effectively. Now, getting implants is possible. You just need to prepare yourself. As long as you take care of the problems with bone resorption and its underlying causes by scheduling a comprehensive periodontal evaluation, a CPE, we can check the severity of the gum disease and plan an appropriate course of treatment. Would you like to know more about getting dental implants and the steps you will need to take them? If so, you can contact us about scheduling an appointment for a comprehensive periodontal evaluation today. And by scheduling the exam, you are taking the most proactive step needed to treat your gum disease or replace any missing teeth by dental implants. So you can give us a call today at the given number and schedule an appointment and the consultation. So see you at the surgery soon. Take care.